You hear an interview with a health administrator called Dr. Marvin Lee discussing an article about delivering high quality non visit care.
Patients are increasingly seeking to have their healthcare needs met without coming into an office, and there's a strong possibility that non visit care will become the rule rather than the exception. I'm Jan Dean, and my guest today is Dr. Marvin Lee, co author of a recent Perspective article about strategies for delivering high quality non visit care. So, Dr. Lee, what do you think that the transition to non visit care systems will look like?
Well, I actually think you'll see a variety of responses. Existing medical institutions will pilot and are piloting these programs and gradually scaling them up. And at the same time, of course, new organisations are entering the market and changing practices, changing how things are done. So I think it'll be a mix of both of these. And really, my sense of this is that it first has to start with culture, developing a culture for non face to face medical care.
Oh, I see. Could you say just a bit more about what you mean by culture here?
So, what I mean is, if you create a culture in an existing medical organisation where an in person visit is viewed as what you do after you have tried, in a very safe and highly effective way, to meet a patient's need remotely, I think this will change the game for how generally your organisation will think about the practice of medicine. I do think that we'll see some existing organisations differentiate and make that leap over, yet some new organisations will perhaps be at the advantage of being able to start from scratch. So I think we'll see a blend of these two responses.
I see. So, you say in the article that the goal of a non visit based healthcare system would be to bring as much of the care and social support as possible into the patient's home. Does the technology exist to do that today?
I think in many instances, yes, and the technology is really getting better. I think it's important to reflect on how things like smartphones, particularly in the last decade or so, have influenced our expectations. There's been a massive shift in how people in everyday life think about this and about how they expect to engage with services. So we really have to find a way to map onto that consumer demand. And I think for a lot of the basic medical needs that people have, the tech is there already.
So, what kinds of things do you mean?
Well, if you look at clinical protocols for primary care, these are designed to help physicians and clients make decisions about appropriate healthcare for specific circumstances. I think you can quite likely do a lot of that very safely digitally before you even consider meeting face to face.
But what about the times when a patient really has to be there in person?
Well, of course, there are still those moments, but I think it's more about when that necessity arises. Is it earlier in the process of care or later? And what impact does it have on the patient involved? I think there are smart ways, when you do need in person visits and interactions, to structure those so they have the least burden on the patient as possible.
Could you give an example of what you mean?
Well, one example we mentioned in the article is a scenario when a person has to provide a blood specimen or urine. They currently do need to be in person, but instead of building up an incredibly expensive office and lab infrastructure around a city, you could build up a very small collection of centres that would be cheap to operate. The patient could simply drop the specimen at the collection point nearest them, for it to be forwarded to a lab, minimal fuss, and wait for the data you need. So you can accommodate these face-to-face moments efficiently.
Finally, how can organizations go about trying to transition towards models that deliver high quality non visit medical care?
In time, as the technology and science gets better, gets more precise, organisations should just look at these situations that require in-person attendance by the patient and evaluate them, and evaluate that requirement against the currently available technology to see if it's something that could be safely transitioned to an online remote system. I think it's important to really critically evaluate every moment that someone has come in. And I think that if you do that, you'll start to see clear opportunities to reconfigure your care pathways quite dramatically.
You hear an interview with a public health researcher called Dr. Pauline Davidson discussing research on a secret safe injection facility in the United States.
Okay, my guest today is Pauline Davidson of the University of California. Dr. Davidson is here to discuss the findings of 2 studies that focused on the effect of a secret safe injection facility in the US. Dr. Davidson, thanks so much for agreeing to talk with me today. So, what was your big takeaway from your research?
One of the things people have said about opening safe injection facilities in the United States is that the US situation is fundamentally different from that of other countries where it's being used successfully. It's an argument that just because it can work in Europe or Australia or Canada doesn't mean that it'll work here. The big takeaway from this research and all the data we have so far is that these kinds of facilities have a similar effect here in the United States as they do elsewhere. They reduce harms associated with drug use, and they reduce social nuisance associated with drug use in the same way they do elsewhere. Basically, anywhere that you have a concentrated street-based drug scene involving a lot of fairly impoverished people using drugs, you get the same set of problems, and the people using drugs have the same set of problems. And these facilities deal with them quite well, whether they're in Vancouver or in Los Angeles and Skid Row, or any other area with a lot of drug use anywhere.
So, how did staff get this secret facility going?
This is an organization that was providing other services to drug users. They were in this really frustrating situation where they had a lot of people they provided services to who were dying of overdoses. After looking at safe injection rooms and how those work elsewhere in the world, they realized that if they waited for advocacy to legalize these facilities in the United States, all their people would be dead. So, after a good deal of discussion about it, they decided to implement something along these lines. Initially, they started by re-equipping their bathroom, so it was better suited to safe drug consumption. But that had too many logistical problems. They couldn't use the toilets because drug users were in there. They had a spare room available, so they refitted that. They modeled it after the Vancouver facility and opened their doors to a group of their longer-term users, and continued ever since.
What actually happens? How do they ensure safety and that kind of thing?
Well, it looks pretty much like an ordinary clinic. It's a fairly large room with 5 separate stainless steel injecting stations, and the staff are always in the same room as the clients. People come in, do a check-in on a laptop, sit at an injecting station, and prepare and then use their drugs. Then there's a couch if they want to sit there and wait for the immediate effects of the drug to wear off. The staff are trained to use naloxone and, if necessary, call 911. And since they're in the same room, they observe people injecting, and if they see some injecting practices that are less than ideal from a public health point of view, there's an opportunity to talk about that. So there's a number of benefits to having a staff member in the same room, rather than just overdose prevention.
What do users like about the facility?
Well, the biggest one that they kept talking about is how they're able to get out of the public eye, take their time, and use in a clean, well-lit space. People talked about using in the public eye and shooting up in a hurry between 2 cabs in the streets. They were very much aware of passers-by, not just because it's illegal. I mean, they're aware of the police, but because they're aware that it's not seen as a nice thing. They're particularly terrified of being seen by someone's children. So being able to get out of the public eye was very much a relief. So there's a serious benefit to their well-being, how they feel about themselves.
Did users have any complaints about the facility?
Mostly that it wasn't open 24/7. They really liked the space, and they would like it to be open far more often. A couple of them also talked about the problem of how the organization couldn't closely coordinate or do referrals to other agencies because they were trying to keep this all in the down low. Users were quite aware of this. They were saying it would be better if this organization was really closely coupled with a treatment agency, and that handoff could be much better. The staff were also quite bothered by the fact that they had to keep the facility to a fairly small number of people and felt like they had to exclude people with mental health issues because they felt like including them would be more likely to lead to disclosure to third parties. So the organization couldn't serve a number of people who were likely at a higher need.